You ready to do some research?
No.
Well, good, because the research that we're doing is an operation.
Oh, of course it is.
Well, why else would we be involved?
So, I
True.
have a new job for you. But first, let me introduce you to our head of research.
Hello, my name is Dr. Robert Cromwell.
I have the same glasses problem as Dr. Suji.
Dr. Blaylock and Dr. Vaughn, I presume. It's nice to meet you. You must be busy adapting.
I'm holding a
to
test
VC,
tube, so
as
you
well
know
as
I'm a
the new
researcher.
therapist.
Yep. Well, he has more in his pocket, too.
But the director recommended you too, so I would appreciate your assistance.
It's nice to meet you too. It would be our pleasure to help.
Good. I'd like you to participate in clinical testing under the supervision of the research lab.
Let me remind you that it is the duty of those in the medical field to not only cure patients, but to also research and pioneer new treatments. Doctors and researchers must work together to fight diseases both present and future. That's the purpose of Caduceus. There may be some interesting characters here, but they're all excellent doctors.
Please think
I
our
consider
characters
myself
are
very
interesting.
fortunate to be able to conduct medical research among them. And on top of that, we now have the assistance of two truly gifted doctors with the healing touch.
I like how they keep bringing that up, but we'll probably almost never use it.
Yeah.
I firmly believe that with your precision, the data we'll be able to collect will be invaluable. That is why I'm so enthusiastic about your surgical skills. You don't have any objections, do you?
Any objections, lady?
Objection!
Vote of confidence.
I was also
even if it
thinking
is highly exaggerated.
Multiple references.
He's a dedicated professional, although he tends to be long-winded.
Now then, there's an operation I'd like the two of you to perform.
So you're saying he occasionally suffers from sesquipedalian loquaciousness?
The research you're contributing to will give new hope to heart disease patients everywhere. I'll explain as I show you my lab.
Okay, so this operation coming up is short, which is a good
It's
thing.
true that many people frown
it's
upon our
kind of
astronomical
annoying.
research budget. Mostly journalists and politicians who are trying to make a name for themselves. You know how difficult it is to produce significant results when conducting revolutionary research. But
This is actually something that I relate to a
also
lot.
have generous supporters such as
Yeah.
Oh,
Research is not
Dr.
as
Cromwell,
easy as people
you
like
have
to say
friends
it
with you
is.
today.
Right.
Would you introduce me? Pretty please.
Isabella. You really should start acting more professional.
I mean, she's at our level,
Look at me.
so...
I look professional.
This is
Me and
Ms.
my
Vasquez.
several test tubes
She's a representative of the
and
Humani-
opaque glasses are the epitome of professionalism.
And my sweater underneath. Okay, so just remember the name, the Humani Corporation. It's an entity,
I'm Dr. Blaylock.
entity that will come up again.
Dr. Vaughn.
Nice to meet you, handsome.
I'm just gonna let this sit here so that it, gets the
Okay.
right amount of awkwardness.
All right.
We're partnered with a number of large pharmaceutical companies and medical manufacturers, including Humani, who've been a tremendous help to us.
I hope my looks don't give you the wrong impression about our company. Humani is a major player in this industry, and I've been known to play hardball when needed.
Humani holds several lucrative pharmaceutical patents and leads the way in regenerative medicine.
Thanks for the exposition.
That's exactly what I was going to say.
Well, if there's anything I can do for you, just let me know.
We have a research specialist from Humani on staff as well. She's a very talented young woman and has produced great results. I believe she's nearby. Cynthia, can you spare a moment?
Of course she's nearby.
It's the sentence, I believe she's nearby,
I'll go get
really
her,
kind
Dr.
of
Cromwell.
creepy. It's like, how do you know she's nearby but not where she is?
Thank you. I'd appreciate it. The operation that you'll be performing would not be possible without her help.
Yes, Dr. Cromwell? Oh, that's right. You said you'd introduce me to the doctors today.
This is Cynthia Kozakov. She's a beautiful woman, as you can see, and quite brilliant.
Cynthia Kazakov? You wouldn't happen to be from Trinity Medical School, would you?
Valerie? Valerie Blaylock?
My hair is always like this.
Yeah, it's me.
You became a doctor! Congratulations!
I think most of the other characters have normal enough hairstyles that it's not really a problem.
Right.
Thanks.
Like her hair's short.
Wow. I never expected to see you here, of all places.
You're going
I mean,
to be
there's
helping
definitely
us?
a bit of
This is
anime
great.
flair to all of it, but it's nothing too extreme.
Yeah.
I'm Marcus Vaughn. Sorry
I
to
mean,
interrupt such a
no one's
touching
hair is
meeting.
that spiky normally,
No.
but it's
Nice
not.
to meet you, Doctor.
It's not full-on anime.
No. Especially since the color is completely normal,
Yeah.
too.
So you
I always
two
like
are
the
old
in
friends.
anime things. It's
I
spot the main
this
characters.
is-
It's
Yeah.
like the only people that look completely ridiculous. Those are the main
Now,
characters.
Sydney, can you explain to them about the cardiac patch?
Ooh, obliterative cardiomyopathy.
Allow me to explain the details of the operation, as well as the usage of the myocardium patch.
So for whatever reason, she
Myocardium
gets
is the
really...
powerhouse of the cell.
The mitochondria is the powerhouse of the
No,
cell.
I said the myocardium. The myocardium.
So for whatever reason, her voice gets really monotone, but like only during this conference. Like it was fine before, you know?
Our patient is a 10-year-old girl with an occlusion in her heart. Her heart functions are deteriorating. If this continues, she'll have a myocardial infarction.
That's fancy speak for a heart attack.
That's where the myocardial patch comes in.
I don't know much about it. It's a form of synthetic membrane, correct?
Yes, it's a new type of synthetic membrane that uses the whole cell voltage clamp.
Words.
Okay.
The membrane itself is elastic and helps the heart move and function.
That's amazing. It truly is a miracle of science.
It's only as
I'll
incredible
trust
as
you.
the skills of the people using it.
Nothing like a little pressure. I don't mind though. That motivates me.
We'll do our best, of course. I can promise you that.
I'm glad to hear it.
So, we'll be applying this myocardial patch by positioning it according to the guide. Is that this operation's objective?
Yes, that's correct. This operation will be performed without stopping her heart. But I have faith in Caduceus and in all of you.
Let's start.
All right, let's begin.
All right.
Let's begin the operation. We'll be operating on the heart. Please open her up.
Okay,
Let's confirm
so
the procedure
like
of
I
this
said,
operation.
this one's not very long,
3
but it's
areas
kind of
of
annoying.
occlusion have been located on the heart. We'll apply the myocardium patch to them all. Follow the guide and keep the placement and angle in mind when applying the patch. If the myocardium patch isn't placed correctly, the patient may undergo cardiac arrest.
Yeah,
Be careful.
that.
Start by
Oh,
applying
boy.
antibiotic
Okay, so we have to
gel
start
the
by
occlusion
putting some
area.
gel on
First
it.
myocard-
The first
carefully
one,
match the location
not all that
and
bad. You just
angle
have to
of the
rotate
patch
it,
with the myocardium
fine.
patch has been successfully
not gonna be
applied
that
to the
simple for the
occlusion
other
area.
two.
Her heart rate is
Okay.
increasing. There's a possibility that the already weakened areas of the myocardium may hemorrhage. If you find a hemorrhage, treat it with the antibiotic gel before its condition worsens. Here's the next occlusion area. Let's continue.
Because,
Will
with this
the
one,
guide moved?
Oh.
yeah.
That
Does
makes
this mean that we'll
no
have to time the
sense.
placement
So
now that
I
the
think
heart
it
is
moves
beating
after
faster?
3, so it'll kind of bounce 3 times. Now, when you place it, it has to line up with the guideline. Like, you can't just place it
Like, you have
in
to
the,
time
at
it?
the right angle. You have to time it.
Apply the patch when the size of the guide
Can you take care of that,
matches
please?
the size of the patch.
Drain
The
or
second a blood
gel.
pool is
No,
formed.
it
Please
was
drain
gel.
quickly.
If
Then
it
it
gets
became
worse,
drain.
then you need
Her
to
heart
drain it.
rate. Be careful when placing the patch. Watch the myocardium.
And I actually did a good job.
But there are
All
still
right.
wounds. Let's treat them all. The patches have begun.
So, like,
and
if
her
it
heart
goes
rate is-
well,
she should
like
be
this,
all right.
it's a really short operation.
It's just
Please close her up.
not common for it to go well.
It's very easy to get that wrong, so I'm actually kind of impressed that I got it like on my first try for
We're
all of them.
finished. Good.
So that's probably gonna be a good score.
We missed. Oh, it's probably like blood pool didn't form.
Oh.
Was that one because you did let one happen? So, dang it, we got an A. Now we got ska.
Flawless operation. Simply perfect.
You know what? I actually agree with you this time.
Patch is sure to integrate with the existing tissue. The patient should recover nicely.
I
If
think we'll
it's
see
sure to
excellent
do that,
results,
then why
Valerie.
is it still like an experimental procedure?
I'm glad to hear
Because
that.
it's never been done before.
But then it's not sure to
I
work.
wouldn't mind doing more operations.
Oh,
like this
well,
one.
I thought you meant short.
No, he said it's sure to work.
Oh,
or
well,
to
yeah, no,
integrate with
yeah.
the
So
tissue
he's
or
talking about
whatever.
like the post-op stuff. So yeah, I don't know how they would know that for sure. I mean, maybe
Yeah.
they've tried testing it on mice or something.
Well, we wouldn't want to take up all of your time. The director has already spoken to us regarding the research on Stigma. We're currently in the planning stages. In time, we'll show you what we're capable of. Right, Cynthia?
Yes, Dr. Cromwell.
She looks unusually morose.
Yeah.
Ska.
The NIH has received a request for help from a hospital in Texas. They're having difficulty with the diagnosis. Based on the patient's chart, there's a good chance that it's stigma.
Oh no.
So this is what we're dealing with, hmm?
These two pictures were taken only a few hours apart. Look how far the focus is shifting. And its size has increased drastically.
A biopsy was attempted, but they were unable to obtain a sample of the pathogen.
So one thing that we're not able to hear as well, since we have the volume on the TV kind of low, but
Yeah.
game has pretty good music.
The patient
All right.
will arrive in roughly 3 hours. Vaughn and Blaylock will be performing the surgery.
We'll check
Because
the patient's
the
condition upon
best
her
course of
arrival
action
and
is
then
definitely to
proceed
make
with
sure
the
there are
operation.
only 2 surgeons in the world that have ever treated this.
Yes. 3 hours later.
Yeah.
We're treading on unknown territory, so we'd appreciate your support, Dr. Tsuji.
I highly doubt that you two will need my help. But I'll get ready nonetheless.
And by that, I mean I will clear up my glasses
Yeah.
so I can actually see. Now, I know it's supposed to be glare, but...
Yeah. It does look a little
Patient's vitals are
ridiculous.
stable. Blood pressure 110/60. Heart rate 60 beats per minute.
Any case history?
She was involved in an accident 2 months ago. Laceration on the right thigh. Looks like they used artificial blood for transfusion. Q-heme blood from Syntec Labs, to be exact.
Are there any contraindication?
None that I'm aware of, but can you check with them just in case?
Will do.
The affected area is the liver. The course of treatment will be determined during the procedure. However, I have
That's
a
exactly
feeling
what
this
you
will
want to
be
hear going
different
into a
from the
surgery.
professor's case.
We'll figure it out as we go.
Even so, I'm sure our experience with stigma will prove invaluable.
with one strain.
Yeah.
Of which this is a different strain.
Let's stay positive.
Expose the pathogen and eliminate it.
According to the test results, this stigma is completely different from the one we saw before.
Good thing we're
There
here.
are some similarities, though, such as high mobility.
It tries every conceivable method to make its victims suffer. It's like a nightmare.
If it is stigma, then there must be a core somewhere, even if it looks different. If we can find and attack it, we may be able to identify the key to stopping it.
A core. Now that you mention it, there was something in the report about that.
That seems like important
That's
information.
right. We saw something like a core when we were operating on Professor Wilkins.
I'm surprised you remember, Marcus.
Call it a hunch.
A hunch? Well, at least we have some hope of defeating it now.
I'll be praying that I don't have to get involved.
It's haunting me. Wherever I go.
Dr. Vaughn?
It's nothing. Let's end this nightmare. Okay, let's begin.
So, more foreshadowing.
Yes.
The exact nature of this stigma and the types of damage it is capable of are still unknown.
We'll just have to open her up and observe it for ourselves.
Okay, so with this one,
Stigma confirmed.
we get to drain
It's
it.
much larger than before.
Okay.
And luckily for us, there's no limit use on the drain.
That must be
Okay.
its core there in the center.
So you can just keep
plan is
draining
to
it
use-
pretty much.
We can't do anything
as
to
much
it
as you
since the
want.
core has enveloped itself within the surrounding cellular tissue. The tissue itself looks highly viscous.
Good job. The amount of cellular tissue around the core has decreased.
Okay, then let's continue this and drag the core out.
And then once the core comes out,
The core's been
Laser it.
exposed. Use the laser to incinerate it. It's working.
Now, in the future, the core's not going to be the only thing that comes out there.
The core
Is this a tumor?
So,
Let's
okay,
burn it
those
with
red
laser.
ones, you use the laser on those.
Okay.
So you take care of the
There
core.
is still tissue left inside
Laser
the patient.
down.
Please drain it.
Okay, I guess you got it.
No, you should have done it. We can actually damage it at the same time.
Ah, okay.
But basically, you don't want to leave the blue or red kind of like tumor things that it spits out alone, because
Okay.
they will drop the vitals if you leave them alone for too long.
Okay.
So again, you just go straight for the core. And I
And
think there's barely
a little
enough
more.
time to take care of those and get the core
Did it
if you're
split up?
fast. Okay, so with this one, don't suck the
Separator.
one. Don't suck the one
Core
that's
has to be in one
laying
of
down
them. Use
the
the drain to
cores
find it.
first,
Okay.
because otherwise
More
that
of
can
the
happen.
tissue has been created. Drain it immediately.
So it's just you want to suck that one up before you start working on the main core, because otherwise you end
okay.
up in a situation where this happens with the main core, and you have the other one like put out those 4 ones at the same time.
okay.
So you can have like up to 7 of those.
Oh jeez. I'm just gonna go for what you're doing unless you tell me otherwise.
They're like, are they both together?
I have no idea.
I guess not. We must have gotten the other one at some point.
We did it. No presence
That's
of
pretty much
stigma
all there
can
is
be
to it.
detected.
It's actually one
You
of the
know if-
easier ones, in my opinion.
Yeah, it seemed like it.
That was an amazing operation.
Well, especially
Let's
with
close
2
her up and be
people.
finished.
Yeah.
Because you can divide and conquer when it you know the core is revealed.
We were
Yeah.
able to deal with it. Somehow.
I hope this is the last time we have to perform an operation in the dark.
Nope, it won't be the last
We're
time.
finished.
Yeah.
Great work, everyone.
Also, you're pretty much guaranteed to get a really good chain on this unless you let one of those tumors like kind of explode, because everything you do is an okay. So you can't get a bad, which will break your chain.
Ah.
Max chain of at least 55.
Also, 2160, which was like the base score or something, is the vertical resolution of 4K.
This is true.
I noticed things like that.
Stigma's mobility far exceeded our expectations.
You all did a great job treating it. I'm glad you're with us.
Would you expect any less from Caduceus' own special disease counteraction team?
It's like such a mouthful.
Yeah.
SDCT. It's not even a good acronym.
Yeah.
We'll hold a conference on this case of stigma
Yeah.
within the next few days.
Really is not.
Of course, I'll need you to speak regarding today's operation and the patient's progress. Your report will also be forwarded to Health and Human Services, so please get started immediately.
Just give me a strong cup of Joe, and I'll crank it out.
Good. You know, there was no way we could have anticipated Stigma's metamorphosis. I was amazed at how well you adapted. I know you have the healing touch. Even so,
This is just going to be a constant thing where they keep mentioning it in game, but we never
It's
use it.
completely irrelevant to
I guess I'm
everything.
just lucky.
There are a few situations where we will probably actually use it, but so it's gas. All right, so I think that will do it for this episode. So thank you very much for watching. I've been redxparasite,
-327.
signing out.